My name's Sandra Taylor. I'm the Director of Provider Services and Commission Care for the London Borough of Hillingdon, and I'm joined today by a panel of professional colleagues who will be presenting information about COVID-19 and the vaccination programme, including challenging any myths and misinformation. After the presentation, I'll be asking any questions that you as social care workers have posed to us so that they can give you some answers, factual information, and the purpose of today is to ensure that you can make the right choices and decisions about taking the vaccine to protect yourself and your loved ones. And for that reason, we'll be making sure that you have the factual information that gives you those choices. I'm now going to ask the panel to introduce themselves. I'm going to start with Sunny.
Thank you. My name is Viral Sunny Doshi. I'm the lead pharmacist, specialist pharmacist in public health, London Borough of Hillingdon.
Thank you. Dr. Goody? Dr. Goody, you're on mute.
Thank you, Sandra. Apologies. So my name is Reva Goody. I'm a GP at the Pine Medical Centre in Hayes in Hillingdon, and I've been a GP in the area for 20 years.
Thank you. Sharon Day.
My name is Sharon Day. I'm a consultant in public health and the Deputy Director of Public Health at the London Borough of Hillingdon.
Thank you. Tracy Hamer.
My name's Tracy Hamer. I'm a registered care home manager for 4 Hatton Grove, which is a residential home for adults with learning disabilities and complex needs.
Thank you, Tracy. Caroline.
Hi, I'm Caroline Morrison. I work with the NHS, third sector and social care organisations in Hillingdon, delivering care to the residents of Hillingdon.
Thank you. Shika.
Hi, I'm Shika Sharma, consultant in public health at London Borough of Hillingdon.
Thank you. Dr. Akin Taylor.
Hi everyone, my name is Dr. Michael Lakin Taylor. I'm a GP principal at the Pine Medical Centre in Hayes and Hillingdon, and I've been practicing in the area for the last 20 years with my colleague Dr. Goody.
Many thanks. We're going to go on to the presentation now, and at the end of the presentation we'll ask questions. Thank you.
Thank you, Sandra. So what we're going to talk about today are the following areas. We're going to look at the background and context of coronavirus and vaccines. Then we're going to be looking at the concerns and anxieties that people have expressed around the issue of the vaccines, and finally looking at myth bustings, and we'll be taking your questions that you've kindly submitted to Sandra earlier. Next slide, please. COVID-19, SARS-CoV as it's often referred to, is a new strain of coronavirus first identified in Wuhan City, China at the end of 2019. Coronaviruses are a large family of viruses, some of which cause less severe disease, such as the common cold, and others cause more severe disease, such as Middle Eastern Respiratory Syndrome, often referred to as MERS-CoV, and SARS, Severe Respiratory Syndrome. COVID-19 is spread through droplets breathed out from the nose or the mouth, particularly when speaking or coughing. It can also be picked up by touching your eyes, your nose and mouth after contact with contaminated objects such as surfaces. In addition, airborne transmission can occur in healthcare settings and also care settings in which procedures or support treatments that generate aerosols are performed. Airborne transmission may also occur in poorly ventilated indoor spaces, particularly if individuals are in the same room together for extended periods of time. Typical symptoms of COVID-19 are shortness of breath and breathing difficulties, a new continuous cough and fever. However, over the past year, a range of other symptoms have been added, for example, a loss of or change in your normal sense of taste and smell. Generally, COVID-19 can cause more severe symptoms in older people, people who have weakened immune systems, and those with long-term conditions like diabetes, cancer and chronic disease. Next slide, please, Claire. COVID-19, its impact on our lives. Mental health problems are more common in vulnerable and disadvantaged groups following individual or community-wide periods of social isolation in the context of public health crises, such as the one we're going through now. There is also a disproportionate impact among vulnerable and disadvantaged groups, which extends to other outcomes such as income, employment, access to food, and discrimination. Abuse and exploitation are and particularly among girls and women, is sadly evident as we go through this pandemic. Since the outbreak of COVID-19, emerging data and reports have shown that social restrictions that confine people to their homes for extended periods has increased and intensified the risk of all types of abuse, exploitation and violence, particularly domestic violence against women and girls. People's capacity to comply with social distancing is another issue. It is well documented that people's capacity to comply with social distancing measures is particularly difficult for those on low incomes, those in insecure employment, and those living in overcrowded homes. Next slide, please, Claire. Thank you.
Thank you, Claire. I now come on to my presentation, which is COVID-19 and the vaccines. So, a vaccine to prevent COVID-19 is likely to be the most effective way to control the pandemic. Scientists across the world have worked very hard to develop vaccines which have been rigorously tested for safety and efficacy. It is crucial that the COVID-19 vaccines are safely and effectively delivered to as many of those in the eligible population. Next slide, please, Claire. So, the COVID-19 vaccines and approval. So there are currently 3 vaccines that have been approved for use in the UK, and they basically include the Pfizer-BioNTech vaccine, the Oxford-AstraZeneca vaccine, and the Moderna vaccine, which is due to be released in spring. It's very important to note that the vaccines are safe, effective, and provide the best protection against coronavirus, as well as reducing the severity of the illness. These vaccines have all met the strict standards of safety, quality, and effectiveness as set out by the Independent Medicines and Healthcare Products Regulatory Agency, MHRA, which follows international standards of safety. All the medicines, including the coronavirus vaccines, must go through all the robust and rigorous clinical trials and safety checks before they can be approved. The Pfizer-BioNTech vaccine was given to 43,500 people during its clinical trial, and no major side effects or safety concerns have been reported. Public safety always comes first, and the vaccines are only made available to the public when they have met this strict criteria. Other vaccines are being developed, but they will only be available on the NHS once they have been thoroughly tested to make sure that they are safe and effective. Examples of vaccines in the pipeline include Novavax and the 1-dose Johnson & Johnson vaccine. Next slide, please, Claire. The first dose of the COVID-19 vaccine should give you good protection from the coronavirus, but you do need to have 2 doses of the vaccine to give you longer lasting protection. To maximize the number of people getting the vaccine and receiving protection, the 4 United Kingdom Chief Medical Officers have agreed that at this stage of the pandemic, prioritizing the first dose of vaccine for as many people as possible on the priority list would protect the greatest number of at-risk people in the shortest possible time. Operationally, the second dose of both the Pfizer-BioNTech and the Oxford University AstraZeneca vaccine will be administered towards the end of the recommended vaccine dosing schedule of 12 weeks. Next slide, please. COVID-19 vaccine and side effects. Most side effects of the COVID-19 vaccine are mild and should not last longer than a week. These include a sore arm where the needle went in, feeling tired, a headache, feeling achy, feeling or being sick. To combat some of the pain, you can use painkillers such as paracetamol if you need to. If you have a high temperature, you may have coronavirus or another infection. If your symptoms get worse or you are worried, please call 111. No long-term complications have been reported, and so far, thousands of people have been given the COVID-19 vaccine, and reports of serious side effects such as allergic reactions have been very rare. Thank you, Claire. Next slide.
Thank you, Sunny. So I'll come on to some of the questions certainly that have been posed by yourselves. Certainly patients ask me these questions all the time, as do my staff at the surgery. And so I'll try and go through these one by one to address any anxieties and concerns over the vaccination. So firstly, do COVID-19 vaccines contain live organisms? Absolutely not. They don't contain live organisms. As Sunny has mentioned, these vaccines have passed all standards around safety, quality, and efficacy. So there should be no concerns there. Should I take the vaccine if I'm unwell? Well, if you're unwell, as in suffering with an illness other than COVID, absolutely you can contact your general practitioner to find out if you are to go ahead with the appointment. If you've had COVID, we still recommend that when offered the appointment further down the line, you actually do take it up, because it actually does enhance your immune response. Will the vaccine protect you? Absolutely. So as we know, the Pfizer vaccine, the efficacy is over 90% after your second dose, and it's over 80% with the AstraZeneca Oxford vaccine after your second dose. What about those who cannot take the vaccine? Well, actually, there is a very small number of people who can't take the vaccine, and the advice is that only those who've actually had a severe reaction to the first dose, or those who've actually reacted severely to any components of the vaccine, shouldn't be having it. But always, you can discuss this again with your health provider or your general practitioner. Are smokers at risk of COVID-19, at a higher risk of COVID-19? And actually, yes, they are. And the reason for that is because, as we know, COVID-19 mainly affects the airways and the respiratory airways and the lungs, as does smoking. We know that smokers have damaged airways and lungs as a result of smoking. So it therefore makes smokers more susceptible to the virus. Also, if you think about it, the very act of smoking, which is basically sort of repeated movements between hand and mouth and increased touch, this will enable the spread of the virus. Coming on to pregnancy and breastfeeding. Now, there are lots of questions that you have posed to us around pregnancy and breastfeeding. So what I'll do is, following on from the presentation, I'll specifically address these. What if you've already had the flu vaccine? There is no reason why you can't have the COVID vaccine. They are very different viruses. What they currently recommend is an interval of about 2 weeks between the two vaccines. Can you catch COVID-19 from the vaccine? No, you can't, because the COVID-19 vaccine does not contain the live virus. But you can obviously catch COVID-19 if you haven't had the vaccine. Can you give COVID-19 to anyone after having the vaccine? No, you can't, because it doesn't contain the live virus. And does the vaccine contain animal products? No, it does not contain animal products or eggs. Thank you. Next slide, please.
Thank you all. I'm going to talk about the COVID-19 vaccination program, phase 1 in the priority groups. As we all know, there are 10 priority groups, but right now we're focusing on the top 4 priority groups. And the information I'm going to be giving to everyone is based on the information in Hillingdon. Now, prioritization is primarily based on age, as the risk increases with COVID-19, mortality increases with age. The top 4 cohort groups are residents in a care home for older adults and their carers. That's risk group 1. Risk group 2 are all those 80 years of age and over, and frontline health and social care workers. Priority group 3 are all those 75 years old of age and over. And priority group 4 are all those 70 years of age and over, and the clinically extremely vulnerable individuals. But group 4 with the clinically extremely vulnerable individuals excludes pregnant women and those under the age of 16. As of yesterday, the update in Hillingdon is that from the Confederation, we vaccinated as of yesterday over 33,000 patients. the vaccination of over 80s, of our population is 84%, and the vaccination rate of over 75 is 90%. Now, we are doing quite well in Northwest London area, and we are ahead of schedule, and we are already vaccinating cohort 5, which is those over 65 years of age. Next slide, please.
Thank you. I'm going to talk about busting myths and disinformation. There's no denying that the last 12 months have been unusual. There's a lot of uncertainty and fear, and information is constantly changing as we learn new things. Some people take advantage of this and spread myths, half-truths, or totally false information, either due to ignorance, or sometimes information is created to be deliberately deceptive with the intent to make money or to cause harm by spreading lies like the COVID vaccine alters DNA, it's unsafe, or it includes a tracking device, etc., etc. Such disinformation is dangerous. Social media is used as vehicle to spread disinformation, and it is our collective responsibility, especially those of us working in health and social care, to ensure that before we press the share button, we ask ourselves these questions. How does this make me feel? Why am I sharing this? How do I know if this is true? Where did it come from? And whose agenda might I be supporting by sharing it? Basically, it's dangerous to peddle disinformation and myths as it places others at risk. Thank you. Next slide, please.
Thank you very much to the panel for their presentation. It's very clear messages to everybody in there. I'm now going to take questions. Claire, could you put the panel back up, please? Thank you. I'm going to start with questions going back to Dr. Goody, just to cover off the point that she raised in the presentation in relation to fertility and pregnancy. We've had an awful lot of questions from the younger female cohort of staff that work within social care and also within special schools and their concerns. So I'd like to ask some questions on behalf of Jenny Bradman from LBH, of Joy Mac Care staff and Ability Housing staff, and also those from special schools at Pentland Fields, Moorcroft and Sunshine House special schools. So, Dr. Goody, can I ask you to just talk through whether or not the vaccines are safe for pregnant and breastfeeding women and what research has been done about this?
Yes, yeah, absolutely fine, Sandra, thank you. So, so the trials actually for pregnant women and women who are breastfeeding have not yet been completed. And so ultimately it is a matter of choice for women who are contemplating having the vaccine and who are pregnant or breastfeeding. But what we do know, the data so far shows that actually admissions and severe illness may be more common in women who are pregnant, especially in the third trimester. And also preterm birth is more likely in these women. Also, what we do know is pregnant women who have underlying serious medical conditions are at a higher risk of serious illness. So that's what the data shows. The guidelines that have been set by the Royal College of Obstetricians and Gynecologists is that certainly two groups of women should be having the vaccine. Those who are pregnant and who are clinically vulnerable or have a medical condition, and health and social care workers who are definitely at a higher risk of having COVID-19.
That's really helpful, thank you. And another question posed by those staff is around any specific concerns from women from a BAME background, whether there's any issues in relation to long-term effects on fertility in general and any pregnancy-related effects for BAME women especially.
Yeah, So the answer to the question is that, again, the data so far, as per the guidance which was published only recently on the 8th of February by the British Fertility Society, is that there is no evidence so far, or actually any theoretical reason as to why the vaccine should affect fertility. And again, the same with pregnancy and effects on the unborn baby. The data so far shows that it is safe, and there are no serious effects on this either. So that's the data that we have so far.
Really helpful, thank you. And just finally, on this topic, how soon after giving birth can people take the vaccine, and does breastfeeding make a difference to that decision making?
So the vaccine can be taken after childbirth. There is no reason why women can't have it. And no, it doesn't affect breastfeeding or certainly babies that are being breastfed.
Brilliant, thank you very much. Tracy Hamer, I'm going to come to you now as the Registered Care Home Manager to ask you some questions. A question posed by staff is, do you think there will be a job requirement in the future to have had the vaccine?
Currently, there's nothing in the pipeline for the vaccine to become mandatory, but obviously we would take our lead from government legislation. But previously we've had to take vaccines like hepatitis B as a job requirement, so possibly in the future, but currently no.
Brilliant, thank you. And in terms of CQC, is there any information coming from CQC about future mandatory requirements?
Not at the moment, but we do have a duty of care to protect our residents from the coronavirus. So, but currently at the moment, no.
Thanks, Tracy. So you're a Registered Care Home Manager. Have you had the vaccine?
Yes, I've had the vaccine.
Well done. And what about your staff team?
Yes, well, I've got a staff team of 30 and 26 out of the 30 have taken up with the vaccine. We have 4 who have refused at the moment. One's pregnant and she was advised by her doctor not to take the vaccine because of underlying conditions. 2 are just getting clarifications from their GP because they have underlying health conditions whether to take the vaccine, and 1 has her own reasons for not taking the vaccine, but she has said that she's open to conversations. Every time I get any new information that comes through, and especially this webinar will definitely, I think, help her to make a decision. Our agency staff, there's been a very high uptake and they've actively been coming to me and asking how they can get the vaccine. And this is across all cultures, especially quite a few of our agency are from the BAME, Black and ethnic minority, male and female as well, and they have been coming forward and asking for the vaccine.
That's really helpful, thank you very much. Dr. Taylor, can I just ask you about a colleague that's had the vaccine on the 29th of January, and the nurse told them that they would receive a second appointment in 3 months' time. And this member of staff reports that they've heard that the Pfizer brand of vaccine is running out of stock. So are they going to get the same one? Should they have the same one? And will they still be able to get their second dose? Are the 2 doses compatible? Sorry, there's quite a mixture of questions within there.
Okay, thank you very much, Sandra. As far as I'm aware, I'm not aware that there's a shortage of the Pfizer vaccine. I believe Dr. Sharma and Dr. Day can attest to that. Information comes from the Department of Health regularly. The answer is, as far as I'm aware, we don't have any evidence of recorded shortages. With regards having the vaccination, the same vaccination, the evidence is that, and the recommendation is also that you should have the same vaccine where possible. There were a lot of mixed messages in the past where it's been said that if there was, in inverted comma, a shortage, maybe you are advised to take a second vaccine that is different from the original one. But the advice is of consistency now. The same vaccine should be given at the same interval recommended by the manufacturers to complete the vaccination series. For example, if you had a Pfizer vaccine, the recommendation is that you should have the second vaccine the second dose after 3 weeks. Now, there's been talk about stretching it to 12 weeks in terms of availability. Now, that's been the recommendation lately, because the government wants the vaccination of population to be as much as possible, to spread the vaccination around. Now, with the AZ vaccine, as far as I'm aware, the recommendation is that you should have the second dose between 4 to 12 weeks. And the Moderna vaccine, which Viral Doshi rightly said will be available in spring, should be the second dose should be had after 4 weeks. Now, the advice to everyone is that we should have the same vaccine to complete the vaccination series. That is, if you had a Moderna vaccine, you follow up with the Moderna vaccine. If you had a Pfizer one, you follow up with Pfizer, and same goes for AstraZeneca. Brilliant. Now, there's no evidence to show that mixing the vaccine is compatible. So the recommendation is against that.
Thank you. A further question is from a member of staff. How do I know how long the antibodies that I have will last? Can I have an antibody test? If I'm now negative, I would then consider taking the vaccine. But as I'm young and healthy, do I really need to have it?
Okay, that's a very important question. The issue of antibody is neither here nor there. Now, it should not stop you from, in fact, if you have an antibody negative result, you are those group of people who should be having the vaccines because you don't have any cover. The antibodies can either be generated from you having an infection from COVID vaccine or an antibody response from you having the vaccine itself. So if you think you're well in yourself and you're young, that is a false belief, because we know COVID vaccine is no respecter of anyone. Though we know it affects the older population more, but we have cases of children, teenagers dying from COVID infection. So the advice is, if you are opportune to have any vaccine at all, regardless of the type, you should take the vaccine, because the efficacy is that all the 3 vaccines that have been recommended or approved by the MHRA in this country have been shown to be very, very effective. So the take-home message is, if you offer the vaccine, regardless of how young or fit you are or well you are, please take the vaccine.
Thank you very much. Sonny, I'm coming to you next with some questions. How can staff be sure that the vaccines that they're taking work on the South African variant? How do you know which vaccine is best? If we have antibodies, what is the chance of getting coronavirus again?
Thank you very much, Sandra. That's a wonderful question, or questions. So I'll respond to that. So basically, all of the COVID vaccines are based on generating an immune response to the COVID-19 spike protein. Now, in layman terms, what this means by spike protein is a part of the COVID virus which attaches onto a human cell. That's a spike protein. Helpfully, the spike protein, in terms of virus terms, is quite large, which means the immune system basically generates many different types of antibodies to the different parts of that spike. Remember, in virus terms, the spike protein is quite large. So a few changes in the spike protein shouldn't mean that the vaccine won't work. The recent UK COVID-19 variant has 9 mutations to the spike gene, but 99% of that spike is still identical to the version the vaccines were designed to target. So nothing to worry about there. Vaccine developers also say it's very relatively straightforward process to tweak the recipe to target any new variants. The availability of the new vaccines basically tailored to the South African variant should be available within months, as the technology is well established. But most importantly, a recent study led by Public Health England shows that most people who have had the virus are protected from catching it again for at least 5 months, the duration of the analysis so far. But it's very important to note that you might be protected by your antibodies, but it doesn't mean you cannot still harbor the virus and pass it on to others. So people who have already had the COVID-19 should still have the vaccine when offered one. Very important, because having the vaccine after recovering from COVID-19 is not an issue at all and will likely boost the natural immunity.
Brilliant, thank you very much. Sharon, can I come to you with a question? So this is a question from Mandy Gibbons, who's a child protection advisor, and she asks that, can reassurance be provided that the Pfizer vaccinations will be effective as they're being given 12 weeks apart, as opposed to the original advice, which was commented on in the presentation, as 3 weeks apart? So could you comment on the speculation in the media that they do not support the efficacy of the figures if the vaccines are given 12 weeks apart?
Okay, thank you for that question, Mandy. It's a good one and it's a challenging one at the same time. Well, at the end of last year, a new variant of COVID was identified in the UK, which has been associated with an increase in COVID-19 cases called the UK variant. And I think at present, as of yesterday, about 90% of all the confirmed cases are actually this new variant, the UK variant. Given this, the Joint Committee on Vaccination and Immunisation, the JCVI, has considered options for increasing the short-term impact of the COVID-19 vaccination programme. So when considering vaccination schedules, the JVCI often advises schedules which differ from the marketing authorisation. In every case, the advice that they give is aimed at maximising protection in the population. So that's what they're seeking to do. So available evidence has shown that for both the Pfizer-BioNTech vaccine and the AstraZeneca vaccine, high levels of short-term protection is gained from the first dose, including against severe disease. As the first doses of both vaccines provide a high level of protection, the JCVI has recommended that initially vaccinating a greater number of people with a single dose will prevent more deaths and hospitalisation than vaccinating a smaller number of people with 2 doses. The second dose is important, however, to provide, as it provides longer lasting protection and is expected to be as or more effective when given at an interval of up to 12 weeks from the first dose.
Thank you, that's a really clear message. And a further question from Joy McCare is, BAME groups are classified as very vulnerable to infections and death from coronavirus. Why did the JCVI not prioritise BAME groups in the vaccination priority list?
Again, a very good question. Thank you, Joy. So there is clear evidence that certain Black and Asian and minority ethnic groups do have higher rates of COVID-19 infection and higher rates of serious disease, morbidity and mortality as a result. However, there is no strong evidence that ethnicity by itself or genetics is the sole explanation for observed differences in rates of severe illness and deaths. Currently, evidence strongly indicates that absolute risk of serious disease and death from COVID-19 increases exponentially with age. You must have heard that word so many times over the past year. Exponentially means very rapidly with age. However, what is also clear is that certain health conditions such as diabetes, chronic kidney disease, heart disease and respiratory disease places individuals with these diseases at a higher risk of serious disease and mortality, death from COVID-19. These health conditions are often overrepresented in Black, Asian and other minority ethnic groups. So, given that the JVCI has prioritised persons with underlying health conditions such as these, this will inevitably provide greater access to vaccination for Black, Asian and other minority ethnic communities, precisely because they are disproportionately affected by such health conditions and are therefore included in the prioritised cohorts that have been identified by the JVCI.
Thank you. Shika, can I ask the question to you? This question is from the staff at Marion House Care Home. And the question is, how do I know I won't become ill if I have the vaccine? 3 of our staff were off sick after having the vaccine, and 1 was for 5 days, and very frail and elderly residents became unwell also after having the vaccine. 1 even fainted. Can you please tell us what your views are around side effects of the vaccine and how these can be dealt with? Thank you.
Thank you. A very good question, and the one that we come across quite often. What I would say is, like all medicines, vaccines can cause side effects. Some people suffer mild symptoms after being vaccinated, like pain in the arm, headache, fever, tiredness, aching muscles. But you have to remember that is not the disease itself, but your body's response to the vaccine. So even if you do have symptoms after the first dose, you still need to have the second dose. Side effects are short-term, and these mean that vaccine is working. Staff giving the vaccine are trained to deal with very adverse reactions, and they can report any unusual side effects using the coronavirus yellow card safety scheme.
Okay, thank you. And that kind of addresses the point, but I'm going to ask the question anyway that a staff member has also posed, in saying that they have severe allergies and in the past have had reactions. How do they know they wouldn't have a reaction to this vaccine?
Well, if you've ever had a serious allergic reaction, you should tell healthcare staff before you vaccinate, or speak to your GP who knows about your medical history. You should not have the COVID-19 vaccine if you've ever had a serious allergic reaction, including anaphylaxis, to a previous dose of the same vaccine or any of the ingredients in the COVID vaccine. Now, having said that, and as I said earlier, serious allergic reactions are rare. So far, millions of people have been given COVID-19 vaccine, and reports of serious side effects such as allergic reactions have been very rare. So if you do have a reaction to vaccine, it usually happens in minutes and staff can deal with it.
Thank you very much. I'm going to go to Caroline Morrison now to ask some questions around how long have staff got to decide about having the vaccine. We know that there are a proportion of staff that have already declined, and what if they change their minds, and how would they go about getting this sorted out?
Thanks, Sandra. So yeah, that's another really important question. So just to be clear, there is no end date for people to make a decision about a vaccination. So absolutely, there is still the opportunity for people to change their mind and access a vaccination. The one thing that we would say is that we are encouraging staff to get vaccinated at the soonest possible opportunity, because it means that the protection there is for yourself, for your family, for your colleagues that you work with, for as long as possible, really. So if you do change your mind and it's something that you do want to take up, as we hope you will, the best route to take is through your employer, and your employer will be able to liaise with the relevant place to book an appointment for you. So that's the best route to take.
Fantastic, thank you. And is there any figures that you can share with the workforce in terms of uptake of the vaccine at this moment in time, and in particular about residents, but also the social care workforce?
Yeah, so at the moment in Hillingdon, as Dr. Taylor said, we are moving very well through the priority groups that we talked about earlier. So over 40,000 people at the moment in Hillingdon have had the vaccination. And in those 4 priority groups, there have been very few numbers of people actually declining. And when people have been declining, sometimes it's been for logistical reasons as well, which we're trying to work with our practices and our colleagues across the sector to overcome. So at the moment, 40,000 people have been, upwards of that have been vaccinated. In terms of the social care workforce, we've been working really closely with care homes. So we've had teams that have gone out into care homes to vaccinate. And as you heard from Tracy earlier, we've had a really good uptake within our care home workforce. You know, again, we've got sort of upwards of 2,000 people at the moment vaccinated for our care workforce, but really keen, obviously, to support as many people as possible to take up that vaccination.
Thank you. I've come to the end of questions of the panel. Is there anything else that the panel would like to share with the social care workforce today? Dr. Taylor.
Yes. I think I missed one of the one of the questions that was asked about how long will the antibody last for. Now, I'd like to go back to that. There's no evidence to show how long the antibody will last for until the scientists working with the vaccines have more data. The teaching is that the immune response antibody you get from having a COVID infection naturally may not last that long. So, and that is the more reason why it's important or imperative that regardless of whether you've had a COVID infection or not, you should have the vaccination. And there was another question that was posed to me. I know we have very little time left. It was about, someone said, has Hillingdon been informed of the best vaccine? The notion of best vaccine is a false proposition in the first place, because all the vaccines are being developed to provide immunity to every single patient group. Now, they've been tried and tested. Now, to reduce increasing risk in the population, all these vaccines will provide almost equal cover for every single individual that has been vaccinated. So I just thought I would like to put that up, that it's a false proposition to think there's a best vaccine out there. Grab whatever you can get. That's my message.
I think that's an amazing message for us to end on. And I'd like to thank my colleagues, everyone here on the panel today, for their presentation to you and for being so clear in their responses to questions. But most of all, I'd like to thank the social care workforce for the amazing work that they've been undertaking over the last few months and probably always. I hope this information is useful and that you join myself and the colleagues in social care that have already undertaken the vaccine and protect yourselves, your loved ones now and for the future. Thank you very much, everybody.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.